Hi, we will read about pleurisy. Pathophysiology. Pleuritis refers to inflammation of both layers of the pleura, parietal and visceral. Pleurisy may develop in conjunction with pneumonia or an upper respiratory tract infection, TB or collagen disease. After trauma to the chest, pulmonary infarction or pulmonary embolism in patients with primary and metastatic cancer and after thoracotomy. The parietal pleura has nerve endings, the visceral pleura does not. When the inflamed pleural membranes rub together during respiration, intensified on inspiration, the result is severe, sharp, knife like pain. Clinical manifestations. The key characteristic of pleuritic pain is its relationship to respiratory movement. Taking a deep breath, coughing, or sneezing worsens the pain. Pleuritic pain is restricted in distribution rather than diffuse. It usually occurs only on one side. The pain may become minimal or absent when the breath is held, or it may be localized or radiate to the shoulder or abdomen. Later, as pleural fluid develops, the pain decreases. Assessment and diagnostic findings. In the early period, when little fluid has accumulated, a pleural friction rub can be heard with the stethoscope, only to disappear later as more fluid accumulates and separates the inflamed pleural surfaces. Diagnostic tests may include chest x-rays, sputum examinations, thoracentesis to obtain a specimen of pleural fluid for examination, and less commonly, a pleural biopsy. Medical management. The objectives of treatment are to discover the underlying condition causing the pleurisy and to relieve the pain. As the underlying disease, pneumonia and infection is treated, the pleuritic inflammation usually resolves. At the same time, it is necessary to monitor for signs and symptoms of pleural effusion such as shortness of breath, pain, assumption of a position that decreases pain, and decreased chest wall excursion. Prescribed analgesics and topical applications of heat or cold provide symptomatic relief. Indomethacin or non-steroidal anti-inflammatory drug may provide pain relief while allowing the patient to take deep breaths and cough more effectively. If the pain is severe, an intercostal nerve block may be required. Nursing management. Because the patient has considerable pain on inspiration, the nurse can offer suggestions to enhance comfort, such as turning frequently onto the affected side to splint the chest wall and reduce the stretching of the pleura. The nurse also can teach the patient to use the hands or pillow to splint the rib cage while coughing. Thank you.